Hello again, and thanks for joining us on the program Preventive Health on CRBC Radio 105.5 Paradise FM. Now, it is always said that preventive medicine is better than curative health. Today, we'll be looking at stretch marks. And just to mention to you that preventive health is courtesy Asiukpo Diagnostics Medical Center, Maurice Leso Avenue, Calabar. We're looking at stretch marks today. It's something very common, but before we go into it, I'd like to welcome my guest today. I'd like to welcome Mr. Sunday Clement. Thanks for coming on the program.
Thank you for having me.
My name is Erim Ega. Join us.
What am I thinking about?
Brace yourself.
This is strictly for your ears only.
This is strictly for your ears only.
Well, so let's go straight to the crux of the matter on the table, stretch marks. What are stretch marks?
Stretch marks are kind of lines that people find very visible on their skin, and it could be influenced by anything. Number one, I'm going to start by explaining what the skin is so that we can appreciate why people can have stretch marks. Skin is an organ that has several layers. It has epidermis, it has the dermis. Now, beneath the dermis, which is the second layer, we have what is called collagen fibers. These collagen fibers work like elastic. So as the skin expands, they're expected to expand with the skin. So if anything goes wrong or anything happens and the collagen fibers lose their integrity, then the elasticity of the skin is lost and you now start having some marks appearing. Thereby, the blood vessels supplying that part of the skin become more obvious and they appear on the surface of the skin as stretch marks. So that is how stretch marks come about.
Okay, that's like the expansion of the skin. The skin
expand.
And so they are those stretches appear.
In fact, the simple way to put it is when the body grows faster than the skin.
The body now growing faster than the skin. All right, let's look at other causes.
Okay, the first is when we have excesses, we have rapid growth. There's an organ in our body which is called the pituitary gland. Is responsible for growth. Is the one responsible. So every human being is expected to grow at a certain rate. But when something happens down the line, something happens and the pituitary hormone is secreted in excess, the person rate of growth will just suddenly multiply and the person will be growing very fast. When the person starts growing faster and the skin is not prepared to cover, when someone is growing, the skin is what provides a coverage for that area. So the skin tries to cover those areas, so it keeps stretching and these collagen fibers which are underneath the skin may lose their elasticity, and eventually that is how stretch marks can come about. Now the second cause of that is for women who are pregnant. Once they approach 6 to 7 months of pregnancy stage, there are certain hormones that are secreted to relax the ligaments in their pelvic area, so that by the time they want to bring forth their baby, the pelvic area will be very flexible for the child to come out. So these hormones that are secreted, they also have other effects on the collagen fibers which are underneath the skin. So when they react with them, most of these substances, corticosteroids, when they react with these collagen fibers, they weaken them, and these are the elastic. So that's why you see someone who is pregnant, after about 6-7 months, the person will start having stretch marks, or maybe after delivery, the person will keep having stretch marks. So that is another cause. Then the third point is when people become so obese, when someone is just adding up weight, or someone has a culture of dieting. Maybe the person feels, I look too big, I need to reduce my weight. Without professional guidance, without a proper nutrition, the person starts starving. So what happens is that the skin reduces because the person has shrink, then expands again because the person went back to eating junks and all that. So when you keep having expansion and relaxation, then these collagen fibers may lose their integrity. Now the fourth thing is the kind of drugs that most people take. They take drugs for birth control, and these are corticosteroids which can affect the function of the collagen fibers underneath the skin. So that's another thing. Then another thing is the kind of creams that people use. People have eczema and they use different kinds of substances, but without paying attention to what the chemicals they're applying on their skin actually contains. So when they use them on their skin, they get absorbed into the skin, goes down into the collagen, reacts with these proteins and breaks them down. So people can come up with stretch marks. So there are a lot of things that could be responsible for them having.
Okay, thank you very much for that deep insight into what stretch marks are all about and the causes. But ordinarily, from the layman point of view, we see like people that bleach, different creams they use. We attribute that to maybe the stretch marks. And then how come that it's common among the women?
Yeah, because women have much more corticosteroid hormones than the male. Yes, if you're a muscle builder, there's a tendency that you're going to develop stretch mark because you are expanding your muscles. You're expanding your muscles, and the muscles is covered by skin. Because you are forcefully enlarging your muscles, the skin will be stretching to cover. You know, if someone is expanding his muscle and all of a sudden you suddenly realize the person inner dermis is showing, then there's a problem. So as the person is expanding, the muscle is getting bigger, you will see that their skin is covering it. So the skin is stretching. But what happens to the elastic property underneath the skin? So once it gets stretched to a point, there's no way the elastic will break and you now start having the stretch marks.
No, I begin to wonder, because why would growth is supposed to be total? Every aspect of your body should experience growth at the same time.
Yes.
So how come the skin is not expanding? It's only the
that is the way the body has been designed. The body has been designed to function that way. But because of our lifestyle, that's why the lifestyle comes in. Because of our lifestyle, our body on a good day produces corticosteroids. That's on a good day. But when you now use different kinds of creams and they contain excess of these corticosteroids, they get absorbed into the skin, making them in excess underneath your skin, combined with what the body is producing. So you are going to weaken the capacity or the function. You're going to impair the function of the collagen fibers. So, and because we are growing, then we have problems.
Well, thank you very much. In case you've just joined us, you're on to Preventive Health on CRBC Radio 105.5. I'd like to give out this number in case you have one or two things to find out about stretch marks. You don't need to flash, but just send a short message. You can send a short message to 0803 6755 758 0803 6755 958. You have our reactions.
Tune in to Preventive Health on CRBC Radio every Friday at 9 a.m.
I still have Mr. Sunday Clement, a lifestyle expert here. We're looking at stretch marks. Sir, what are the effects of stretch marks?
Okay, it's not a disease. It's not something people should be afraid of. But most people don't like, because sometimes you go to avenues where you need to pull off your shirt, and it could be scary to some other people when they see the kind of stretch mark.
It could look ugly.
Yeah, so the social
causes a social withdrawal.
Yeah, so that could be a problem. That's just the effect that I may say. Doesn't have any medical implication, or maybe it's a disease or something people need to be afraid of. But it's just important that people need to look after their health, because when you imbibe in cultures or habits which deliberately add more to the level of corticosteroids in your body, you keep destroying the collagen fibers, which are protein in nature, which are supposed to be the elastic point. So when that is not given, will give the skin the elastic property. But when that is destroyed, then you definitely end up having stretch marks around the body. For women, it's usually common on their breast, their side of abdomen, and their back. They have stretch marks. Then on their hips, they have stretch marks. But for men, usually common on their shoulders and the upper arm. That's where you usually find that of men. So it's important people need to look into the area of like their lifestyle and be sure that this is what is causing it.
Maybe before we get into prevention, let's look at the cure. Is there any cure? Is there any way you can maybe redirect kind of?
Yeah, there have been a lot of recommendations, drugs and all that, but I would not advise anyone. And the extensive research have shown that there's no cure for it. It's just what people need to know is that they need to, number one, change their lifestyle, modify their lifestyle. That's number one. Then number two, to be patient. The stretch mark can clear off if they can give it time and change their lifestyle. But if you keep doing the same thing, you keep destroying these collagen fibers, then there's no way what you have there will go. Of course, there have been some study lately that show that when you apply olive oil, the olive oil that people use on those stretch marks, with time, they help to, yes, they tend to clear it off. So that is provided the person also includes lifestyle modification. So if that is combined together, then you could have some result. But for someone to go and take a drug because he wants to get rid of the stretch mark is not advisable.
So would that go for prevention?
Yeah, the prevention is number one. When you want to get a cream, ladies, they like creams a lot. When they see their friend looking more beautiful,
ladies and most men, a lot of men go for creams now.
So they want to look beautiful like their friend. Like, sister, please.
What cream have you been using?
I don't know you, but I really like you. I want to know your cream. You need to find out because it is genetic as well. If someone close to one has stretch mark, there's a tendency that it could be passed on. So if you have a tendency to have stretch marks and you go ahead and use cream that is not meant for you, then you can end up in trouble. The first thing to watch out for when you want to get your cream is to look at the content, to look at the percentage of corticosteroids the cream contains. So if it's very high for you, then it is considered not to use it, because if you keep using it over time, they absorb into the skin, then go down there and destroy the collagen fiber. So as we grow, the stretch mark will start coming up. And the second thing is that people need to imbibe the attitude of taking a lot of antioxidants, taking a lot of fruits, taking a lot of water. Taking water is very good. Then normal hygiene of the skin, washing the skin well and all that, because some of these corticosteroids which are produced by the body are brought to the surface, which are supposed to be cleared off. So these are some of the things that people need to watch out for, and reduce drastically the kind of pills. People take a lot of pills to prevent this, pills to prevent that. It's very important that people need to stay away from those things.
Okay, but on the whole, you had said that stretch marks, they are not life-threatening.
They are not life-threatening at all.
Okay. All right. We're looking at stretch mark, and I still have Mr. Sunday Clement, lifestyle part. Basically, before we go, any other message?
Okay, generally, we just advise people the best way to prevent them. Some people already have them. There's nothing to fear. They just need to pay more attention to their skin, watch what they apply on their skin. They should avoid chemicals. Some of these local chemicals are not well refined. They are not laboratory standard. They just have them by the side of the road and they just keep applying them on their skin. They have long-term effects of destroying the collagen fibers. Then the second thing is to get creams that are natural, close to natural as much as possible, can be applied on the skin. This contains vitamin D and E and helps the skin a lot. And to avoid direct exposure to sunlight as well. So when they are exposed to excessive sunlight directly on their skin, there's excess of corticosteroids which are produced to protect the innermost structure of the skin. So they stay away from all these things and everything will be okay.
Well, thank you very much. I've been talking with Mr. Sunday Clement of Asiokpo Diagnostics Center, Merisleso Avenue, Calabar. I'd like to thank you for coming on the program today.
Thank you for having me.
Well, it's been Preventive Health on CRBC, and of course, we took a look at stretch marks. Until the same time next week, we hope to come up with yet another interesting topic. My name is Erim Ega on behalf of the program producer Stella Ifrin.